In today's video, I want to talk about life after chemo and also cancer. Now, honestly, my fiance has been kind of telling me I should make a video about this. And then ironically enough, she sent me a post that someone made talking about exactly this topic, right? Life after cancer, which is really different for everyone. So I simply want to talk about my personal experience because I do believe my scenario was, yes, it was bad, but it can always be worse. And what I mean by that is, from what I've learned about cancer and exactly what goes into it, there is obviously an insane amount of cancers out there, and everything is treated really differently. And even in my case, my cancer was very weird, and they actually had to really meet and determine what treatment I was going to go on. It was either going to be a 9-week treatment or the 27-week treatment that I ended up doing. So what I have found is everyone's experience is always different. There obviously are some people that have very similar experiences depending on, unfortunately, how popular or common certain cancers are. So realistically, when you go through something like that, it can drastically change your life. And one thing that I was ultra grateful for was basically the time and energy I put into training my mind and having the right mindset going into a life-altering situation like this. And unfortunately, I don't really think there's a lot of people that actually have the mental fortitude to really see, and I hate to even say the positives of going through something so terrible. And when you don't have the right mindset going into a situation like this, it's just going to make it way harder. And one of my goals, something I want to do to give back is talk to people that get diagnosed, are going through chemo, or about to go through chemo, or just finished chemo and are looking to get back into life. Just because my experience was, as much as it sucked, I do believe that based on my recovery, how I am almost 8 months post ringing the bell, and how I was really just to get back into my normal day-to-day life and really recover faster than most people, I believe that's a way I could lead by example and give people some tips, advice, and just be someone to talk to. So if you're watching this and you know someone that's about to go through chemo, or they just got diagnosed with cancer and there's a lot of unknowns and a lot of fear, and they feel alone because unfortunately some people don't, I guess it's fortunate that people don't know too many people that actually go through cancer, or they know people that go through cancer, but they're a lot older, especially being younger. I would absolutely love to be a resource. So feel free to send them my way, and I can just honestly just have a conversation with them and kind of talk about my experience, which I will talk about now. So for me personally, chemo sucked. It was 27 weeks, but realistically, I got my surgery to remove the cancer out of my bone in May, but everything started in April. So realistically, from April to January, that was my cancer journey all of last year. And it's not like you ring the bell and you jump back into life and the next day I wake up with a full head of hair. For a majority of my hair is coming back. So what happened with me was I rung the bell, and then the next day I had a fever and I got the flu because at that point too, not only is my body exhausted and it's at its weakest point, my white blood count, it was also dropped because of the chemo and all that stuff. So I was bound to get sick, and truthfully, getting the flu wasn't a surprise. But the good thing was my body was back to a state where it was getting ready and starting to reproduce or produce white blood cells so it could fight the infection. So probably 2 to 3 weeks after I got over the flu, and now I'm 2-3 weeks after ringing the bell, I definitely was very excited just to get back to a normal daily routine. And it was not as easy as you would think. Not that I even thought about it, but I personally had a lot of gratitude because there was just things that I had to do for days and weeks on end the previous year going through chemo that I don't have to do anymore, right? Because for me, part of my treatment which I was basically in treatment for 3 weeks in a row. And then I was quarantined for a 4th week. And then the 5th week I was off, even though I was pretty much shot and rested and not really doing anything. But during 2 of the 3 weeks I was in the actual treatment center of MSK, I would go home with an IV backpack. So I'd go home with a backpack that would pump fluid into me, and it was, you know, you have a port that is basically direct access to like your main like blood, or it basically into your heart base. So that's how the chemo gets pushed throughout your body through your bloodstream. And they do it through a port because the chemo is so toxic. If they do it through a normal normal vein, like you would get blood work, there's potential that the chemo leaks and burns to your bone. How fun. So instead they go, we're gonna directly connect it to your heart in simple terms. But that's why even now, like, you know, people have these scars from what their port is. It's basically a device that it connects to your main artery, and then the chemo gets pumped in through there along with medications. So for me, that 2 weeks I would go home with the pump, or for the week I should say, and I would have to wake up every 3 to 4 hours to urinate, but I wasn't able to just necessarily pee. I would have to measure how much I peed or output. And then I would also have to take this medication called bicarb to make sure my pH level in my urine was high enough, because if it wasn't high enough, then my urine could solidify in my kidneys and cause a kidney infection or kidney failure. Pretty extreme stuff. So there's a lot of pressure on you. So you're not sleeping really, and you're not resting, and you're doing this for multiple days in a row. So just being able to sleep without knowing I'm never gonna have to go home with an IV backpack again, as of now, is, you know, a weight off your shoulders. And the reason why I even say as of now is because, unfortunately, you know, there are a lot of people that end chemo, but then something happens. Like, the journey's not over. I don't even like saying I'm a cancer survivor, because unfortunately with cancer, depending on what it is, if there's most cancers have a chance of reoccurrence. Now, sometimes it's really low after chemo, sometimes it's really high, but there's so many unknowns and so many variables that can affect that even though you ring the bell and your body goes back to, you know, you can get your body back to normal, your hair grows back, you still have this fear or this anxiety that it can reoccur. And that usually happens when you are going to go to your 3-month post, you know, chemo scans, where they'll do, for me, I got a CT scan on my chest, because what's likely to happen if a reoccurrence occurred was there'd be nodules in my lung. And they also checked my leg where the bone cancer was, but there was clean margins, but you never know. But if I'm being truthful, you know, if I ever have weird pain in my leg or something just doesn't feel right, you get thoughts of what if something's coming back, and it sucks. And if, you know, luckily I have my fiance to talk to about, because she had a bone tumor herself. Gratefully it was benign, but it did reoccur, and anything reoccurring is super scary, and it really messes with your head. So for a lot of people that finish chemo, yes, it's a fantastic milestone, but the journey's not over. And that's what can hold people back from getting into routine. And me, I have a very stoic mindset. I'm really big with, you know, control the controllables. And my goal right now is to be my best healthy self, because I can control that. And that allows me to focus on growth, focus on my health, be present, be ultra grateful, and not, you know, catch myself in these negative emotional swings where you start thinking, what if, and you start overthinking, you get anxiety, and then that can lead to like depression and not doing anything, which then causes you to think even worse, right? So for me, it wasn't until probably 2 to 3 months post ringing the bell was when I really felt enough energy, and it was right time for me to start getting into a fitness routine, which was extremely humbling because I gained 50 pounds. Now in my situation with my chemo regimen, it's actually more common for people to lose a lot of weight. So for me gaining weight, my oncology team wasn't upset about it because you would rather someone gain weight than lose weight. And a lot of people think, oh, well, it's probably from the medications. That's part of it. Part of it, you do get, was getting a steroid medication that was there to protect my heart from one of the chemos. And that steroid medication can increase your hunger hormone. Realistically, it's like the opposite of Ozempic. So I already have a fat boy appetite, so I was able to eat more, but I actually, 80 to 90% of the time, I was eating really healthy food. I wasn't eating bad, I wasn't eating crap, maybe on occasion, but I was eating a lot of calories. And no matter whether food's healthy or not healthy, if you're eating more calories than your body's burning, you're gonna store body fat, right? It's basic anatomy and nutrition 101. And when you're in treatment and you're going through chemo, you don't do anything typically. You don't work out, you're sitting all day, every day, you're resting, you feel like crap. So it does make sense why I gained so much weight, and now I'm on a journey of losing that weight. But the other side of it was my actual muscle. I lost so much muscle, I lost so much strength, but muscle memory is a real thing. And I found that my strength is coming back. I would say, even in certain cases, a little faster than I expected to a certain degree, but it's crazy because now there's exercise movements that I used to not like because I wouldn't feel, a good activation, or I just didn't, wasn't crazy about it, that I do like now. And I'm like sore in areas I usually wouldn't be sore about. So for me personally, I find that interesting because I've been on both sides, but for others who didn't maybe have that, they can care less. So the bottom line, and I guess the biggest message that I want to say in this is, for me personally, post chemo has been amazing, right? I'm more than grateful for, how everything's been. My oncology team is highly impressed with my recovery, not only from physical and just like how I'm saying I'm feeling, but also what my blood work that I personally get done myself and what those tests show, because it basically showed that all my organs are functioning at an ultra high, efficient, very healthy level, which is surprising because 6 months ago, they were just getting pumped some of the most poisonous toxins they'll ever face. So there's all this positive, and a lot of it ties not only to just my lifestyle, but I do believe it all stems from the mindset that I have conditioned and trained myself to have. I definitely hope to help at least one person. And if you know anyone, please share this video. And if you're that person watching this video, feel free to comment. I have 26 subscribers at the moment, so your boy is gonna see your comment. And follow me on Instagram, message me, we can talk. So that is day 3, but it is actually my 4th YouTube video. Thank you for watching. See you tomorrow.